ask an inverted question. I don't ask why the area is hurting so much as why are you not hurting in the surrounding areas? And the answer to that is they're not functioning well. You're just going to tilt your head to the left for me. Tilt your head left.
Oh.
That was a good one.
Exhale. Good. How's that feeling? All right?
Oh, yeah.
Not too scary?
We're good.
All right.
Aw, thank you.
Oh, you did so well. Thanks so much. All right, you
Just
really
watched
good.
all your videos.
Oh,
All right. Thank you.
Wow, really cool. Thank you for the support. That's
I'm a family therapist.
Okay.
So I sit a lot and do therapy and do talk therapy.
okay. And tell me about your pain today. Chief complaint, shoulder?
Yeah,
back?
so I do struggle with migraines, but it's primarily this side into
Okay.
the shoulder and then the right lower side. I did x-rays a couple years ago to see a chiropractor. And it was always just sort of like this lower back area, I feel like.
Did you picture the lower back and they just said, remember anything they said? Just the gist of it, just
No, I
alignment
don't.
issues they were looking for?
Yeah.
Okay. And do you have anything going on in your arms? Any numbness on the hands? Any
Sometimes
sensation?
on the right side,
Okay.
some like tingliness, numbness.
Okay.
But for the lower right side, that I typically kind of feel just going down like up to here.
Goes into the thigh a little bit.
Yeah.
Have you had it go down lower than that, or just
No.
stays there at the thigh? All right. And how long has that been going on? Have they both been going on about around the same amount of time, the shoulder and the lower back?
Yeah, so the shoulder typically goes along with like the headaches.
Mhm.
So when my headaches are more severe, then the shoulder really bothers me.
Kind of more end of the day, like after a long day of work, or you feel it in the morning when you wake up? Is there any rhyme or reason to it?
It's not in the morning, towards the end of the day typically.
More stress, okay.
Yeah.
And then the same thing with the lower back, kind of more end of the day, or?
Yeah, that's the end of the day. Sometimes in the morning, but I do a lot of like stretching before I start sitting down for the day. I roll my like upper back.
Okay.
And then I typically stretch backwards like on the roller and do like a lot of pigeon poses to just loosen this area.
All right. Have you been told by anybody about what explanation? I'm just curious where you've been in terms of explanation for what's causing this.
What's causing it? So typically I know this is really tight, so I know sitting down, I've done a couple exercises.
Okay.
I typically do see a chiropractor. So we do like stretching before, and it's a lot of like massage work with it.
Did they? I mean, the symptoms down your leg. Did they explain what was causing that? Not really. Okay.
No, not
All right.
really.
All right, no worries. I'm just seeing where we're starting here. So we're dealing with whenever you deal with local pain. Sometimes the joints in your lower back. There's really two structures in your spine that I'm feeling. You have the knuckles,
Okay.
where the two bones connect together and where they pivot together. This joint has a lot of feeling, and then
Yeah.
obviously the nerve coming through this hole on the side. If that nerve gets hit, this will radiate down your leg.
Okay.
So when we have inflamed joints, you'll have sometimes pressure, even tightness in the lower back because the muscles will try to protect it. And then if you're inflaming the nerve, it'll go
Into
farther
it
down the leg. And
yeah.
then the more you aggravate it, it'll go all the way down to your foot. So we're dealing with nerve root pressure. You can have some of that from just joint inflammation, but more likely we have some level of disc involvement.
Okay.
This is where an x-ray does you a disservice a little bit because we miss if there's a disc injury. Sometimes you're pretty young, 20, 32.
Yeah.
So at this young age, you're not going to see, you actually can have a swollen disc on x-ray and it look really good.
Okay.
And then if you get an MRI, you can then see that the disc is not only swollen, but it's bulging out. And we miss that on x-ray. And so when we're dealing with younger patients, I get a little sad when they only have x-rays taken because they can miss the soft tissue disc injury that would explain that. So without an MRI, I can see how we're not going to have a good explanation for that. But it doesn't change my treatment, but if you wanted to see it, what we want is an even aging of your spine. What I typically find is that as people are aging, parts of their spine are aging very quickly and parts are not aging at all. In order to safely restore the curve through stretching, we have to make sure all the parts of your spine are moving.
Yep.
So that's sort of the first, I call it the soft tissue rehabilitation. We need to go through your spine, unlock everything, make sure it's all working. If it's all working, we can go right to stretching. The stretching changes the alignment, or at least can undo some of the alignment that your work requires you to be in, where, Ed, I simply have to sit. I can't change that too much. We can show you some things when you're sitting to help support. You've probably heard of lumbar support, cervical support. We're trying to support that arch. When the arch is in your spine, there's not as much weight on the disc. When we're bent forward, there's a lot of pressure on the disc, and that's what causes over time it to start herniating or bulging out. So we want to be aware of our alignment. We're going to go through your spine. When was the last time you've been adjusted? How long ago?
Beginning of December.
Okay. All right. And they do manual work, clickers, or
No, manual work.
Okay. Any massages? Any deep tissue massages?
Yeah,
before?
so the tingly thing, those little like pulsing things.
The electrical?
And yeah,
Mhm.
and then it's like an orthopedic like massage in that area. So they typically do like the shoulder.
But with what? Like instruments or with their hands?
Hands.
Okay,
Yeah,
good.
hands, and then the neck adjustment.
Okay. All right. The electrical, just as a side note, it's more for nerve distraction. It doesn't change physiology. You're fine. You're fine. I'll look at you. You're perfect. You're good. You're good. All right. So our head's about 2.5 inches forward. This is what the sitting does to us, is that
Go forward.
well, the ligaments on the front never get stretched. So there's rubber bands on the front that when we sit are tight, and then the ones on the back get
Yeah.
lengthened. And so when we get back up from sitting, our body retains that
Yeah,
forward
yeah.
posture. And that's the explanation for the constant, I'm sure, stress in your upper back.
Oh yeah.
Right. And so it's postural. In order to get your body back to want to be in neutral, we have to overcorrect. So we have to take you farther back so that your body will want to be in the middle. Bend both the knees for me, and then feet flat on the table. All right. Take one deep breath in for me. Deep breath, and then let your exhale for me. There you go. Here we go. Deep breath in. Very good. And exhale. There you go. Nice. Very good. Deep breath in. And exhale. Good. How's that feel? You all right?
Oh yeah.
Not too scary?
We're good.
All right. Perfect. Put your hands around your belly. There we go. Take a deep breath in for me. You're going to look over this shoulder as best you can. And then exhale. You're not going to fall. I got you. Exhale. Not going to fall. I promise. Nobody falls. Exhale. Other side for me. Perfect. So, remember how, you just relax for 1 second. Remember how all the stress happens here in the lower back?
Yeah.
We're trying to adjust the joint below, and we're adjusting the joints above to take the stress off the lower back. So it's about looking at the areas around the areas that are typically overstressed and asking the question, why are they not hurting? I ask an inverted question. I don't ask why the area is hurting so much as why are you not hurting in the surrounding areas? And the answer to that is they're not functioning well. They're tight. Deep breath in. I got you. And then exhale. Twist. Exhale. Good. Let's go face up for me. Very good. Face up.
I find you. Probably like a good year.
Okay.
Year and a half.
Wonderful.
And then I was like, I need to do this. So then I found a chiropractor, and then I was like, I think I need to go down there. Why not go to Florida?
There you go. You said
Why not go to Florida?
your friends are in St. Pete, you said?
Yeah, my
Oh.
cousin.
Oh.
And so I showed them last night, and they're like, I want to go. How do I go?
No, very cool. I'm glad to. I used to be Eckerd College up there in St. Pete. I went there for, well, my 4-year college degree, and that's, my sister and I both went there. And so yeah, I used to be in downtown St. Pete area.
Oh, is it in St. Pete?
Right across the Sunshine Skyway Bridge. Right across the bridge is the Eckerd College, is right on the water there. So I lived in St. Pete for a number of years, and
Oh, it's pretty.
all those one-way streets in downtown. Though, oh my gosh, I lived there before GPS. It was terrible. It was terrible. You get lost down there, and how do I get out of here? Anyway, it's all cheating now with GPS. All right, I'm just feeling how. So the upper neck is designed to be your main engine.
Okay.
If the upper neck is tight, we typically overstress your lower neck. I'm more concerned. The headaches is easy to fix. I look at it as not as an expensive thing to fix. The sensation going down your right arm concerns me more because now we're dealing with nerve pressure. So that's sort of the more important thing to monitor. Does that make sense? If that's getting worse, then
Yeah.
this is where again somebody should have ordered an MRI with that symptom. Should just this top guy a little bit. Let it go. There we go. Now we know what to do. Real tight up there. Chin up. There you go. Beautiful. She's a quiet clicker.
I'm quite.
The areas that are symptomatic are usually moving too much, so I don't understand why we want to keep moving those areas. And that might be why you're used to it. Everybody's adjusted your lower neck, but they're not adjusting the upper neck that well. Again, as a patient, it's tough sometimes. Like, I don't know, my neck was turned. It's hard to describe where I was adjusted. Oh, yeah, feel this knot right here?
Uh-huh.
Yeah. Usually we name these after old relationships. Broke my heart. Now he lives in my, gotta evict it. So, there we go. So they make a piece of foam called a Denerol, and it helps to hold you really here. And so, as much as I'm feeling with your neck, you're really ready for stretching because you've been adjusted, you've had this soft tissue work.
Mm-hmm.
Many people I want to spend like 5 visits getting them loosened up, getting everything working so that we can safely do it. Otherwise, we run the risk of aggravating the loose areas, but we got enough mobility here that we should be able to get you right on stretching, and then you can, essentially like giving you a toothbrush and allowing you to brush your own teeth. You know, you're ready. Yeah, this is, so the suboccipital area, when this area is inflamed, it can overlap with the nerves that go to the face.
Mm-hmm.
So there's a tract called the trigeminal thalamic tract that gets irritated, and that's what causes what we call referral pain to your face. When the upper neck has tension, inflammation, it gives you a headache. More lay term is a cervicogenic headache or a tension headache, but it has to do with just soreness, bruising. The bruising and the soreness happens because the muscles are working harder than they're supposed to be, right? So because the posture is not correct, the muscles work too hard, they build up a lot of lactic acid. This is why it'll be perpetual and ultimately is an alignment issue. Okay, you already know all this. So everybody's been putting the electrical stuff was on your lower neck, upper back area. Where was that?
Yeah,
You think? Yeah.
lower and sometimes in the lower back if the lower back is like more irritated, I feel. So I can ice it, and it typically helps.
And
for a little
who,
bit.
did you know to ice, or did they tell you to ice?
Oh, they told me to ice.
Okay. It's good to ice. Ice is good for the disc.
Yeah.
You don't want to put heat on it, but the electrical is just a nerve distraction. It's a therapy. It doesn't. Here's my main problem is sometimes people put on a TENS unit to do more.
Mm-hmm.
And so if we distract our body from what our body's trying to tell us to do more, you end up hurting yourself. You know, so it's, you know, if it helps you sleep, it's one thing. If you do it to do less, but you know, our world demonizes inflammation. I mean, even our terminology for pain, painkillers.
Yeah.
You know, it's like, well, the body's trying to tell you something. It's not, body's not here to annoy you. You know, but we need to understand what the body's trying to say and where the stress is coming from, what's causing the inflammation. Inflammation is your body trying to repair itself. It's not this thing out to get you and ruin your day. It's starting to come out. And that's where I want you combing. Right there, work on that knot.
Oh, that I feel. Okay.
Mm-hmm.
And that's from like posture.
Right, these are the
Yeah.
attachments, yep. So ultimately that can't ever go away if we don't get the head, we call it forward head posture.
Mm-hmm.
The middle of the ear hole should be over the center of your shoulder from the side. That's what I was looking at when you were standing. And that creates this tension here. It's like holding a bowling ball in front of you versus holding it close to your body. Just your muscles are having to work harder. Muscles build up lactic acid, which then irritates the nerve, gives you a headache. So it's a postural problem, and adjustments don't change posture. Massage doesn't change posture. I wish as much as I wish it to be true. Get your head back a little bit. Here we go. Very good. One more time this way. Mm-hmm. There we go, I got it. Just this top guy a little bit. Let me have it right here, let it go. There you go. Oh yeah.
That feels so good.
You did great. Yeah, really good. There's not too much asymmetry here that I'm looking at. So usually some people have a lot of left to right asymmetry. One side will be higher than the other. There's a little bit here on the left, millimeter, a little bit higher left shoulder. You know, everything's going to be overworked on that right lower. So the right lower was the leg that had the symptoms going down, because your biggest avoidance area is your left middle, and then it's going to be right lower abuse, but it's very slight. I can tell you've been worked on. So it's going to be important that the main thing is that we're rounding forward. So we want to start learning how to counter stretch. The shoulder is really a reflection of the neck. The more the head is out of alignment, the more the shoulder goes out of alignment. The shoulders round forward to alleviate pressure on the lower neck, so it's an avoidance. So let me back up here. The head goes forward, nerve pressure in the lower neck, shoulders round forward to alleviate pressure in the lower neck. That pops your ribs out here in your upper back, loses your curve in your lower back, causes leg pain. We have a number of dominoes here. But the shoulder rounding forward can only be alleviated when there's no longer any stress on your lower neck. The shoulder rounding forward of the shoulders is happening as an avoidance. It opens up the hole that the nerves go through a little bit. Relieves. You would have more symptoms if your shoulders weren't rounded forward. It's all ultimately under the predication that your lower neck in and of itself is doing too much work. The upper neck is tight due to the head being forward. There are nerdier, if believe it or not, chiropractors than me that all they care about is getting your ear over your shoulder. Question is, why wouldn't you have all these symptoms? These are inevitable because our alignment is not correct. And we just don't have anybody really, or very few people, really concerned with alignment. It's all based on more symptoms and how you feel and reacting to tight muscles, like somehow the muscles are tight just to bother you.
Got it. That area just feels like tighter, but it doesn't feel pain. It's only when you go up into the shoulders.
In the shoulders, yeah.
Yeah, like that area, that I feel
So-
more than that
Okay.
other area.
These are just the roots of your neck. These are under a lot more. So this area is more of an abused area. This is hurting because of
The posture.
your posture
Right.
and the roots of your neck attach into your shoulders. These attachments are inflamed. So when I touch the attachments, ow. This area is more, it's locked, but it's not really injured in here. Does that make sense? It's not
Yeah.
an injured area. It's a frozen area that as we unlock it might start being annoyed that we're asking it to function more. See, the brassiere is in here, and this area is protected. And it prevents this area from functioning at a high rate. I didn't write the rule book. I'm just telling you what you have to be aware of, that this area is protected, it's guarded, it's bound up, and the areas in the surrounding areas will then do extra as a result.
What is that?
Yeah. What is that?
What is that?
Injury, scar tissue, tangles. The original tissue in your body was organized, and then when we had injury, see, the middle back is supposed to be your first functioning part, and so when you were a young teenager, this part, a fall off a trampoline, or you have to tell me, some old injury happened here initially, and then it froze up.
Okay.
And then everything you're experiencing today is more of an event that happens as a result of parts of your back quitting, and only a few remaining vertebrae are doing all the work. So this is the original, this is the original area that's supposed to do the work, and it's become tight. And now it's going, what are you doing? Hey, I quit 20 years ago. Who do you think you are? And we have to tell it to start working again. And a lot of joints in here. 12 vertebrae in your chest, 4 joints at every level. So really 48 joints in your chest. A lot of mouths to feed in here.
Oh, wow.
All it takes is a few joints in here to be upset to ruin your day. I'll push these ribs down in a second. Right there. Yeah. I don't know, when you go back home, you guys tell them that your middle back feels tight. I wouldn't even really mention your lower back.
Okay.
Try to guide the practitioners up there to help you unglue this. I believe you'll get much more relief to
those areas.
the other areas. Yeah, these roots need to be pushed down, but it won't really change it ultimately until we get the head back. We have to get your posture changed. The inflammation here is just postural. So working on this alone, won't get rid of it. It'll feel better for a few days, and then it just comes back, and we live this depressing relationship where you don't really ultimately fix it.
Was that your finger or what?
It's my elbow.
Oh my
What the heck is that?
It's a very pointy elbow.
Oh.
Usually when I tell you to get an Epsom salt bath or go to the Gulf of Mexico, maybe because you're from up north, maybe, I don't know.
We're gonna go by the beach. Can I
Go,
sit in
go,
the
go,
water?
go lay in the water. Yeah, it'd
Go
be
lay
great
in the
after
water.
this.
Okay.
If you can handle it. I as a Floridian, no way, but maybe it's is it Connecticut? What is it, Vermont?
Connecticut.
Maybe 60 degrees is not that cold to you. It's freezing to me. I don't know what the temperature
I
is.
know, we
It's like-
saw people wearing sweatshirts and we were like, what is going on?
And I'm
It's so
sure it's
different.
like the best part.
This is burning up hot down here.
Are all those knots or just inflammation?
Right, the roots are coming out of the bone, so because there's constant tugging, right? So I'm trying to push down these attachments, loosen up the vertebrae, make your spine more malleable and flexible so we can stretch. The tighter this is, the less effective any stretching is going to be. You found the crunchy spots
Uh-huh.
right there. It's actually like right above where the strap contacts you. Right there is right above. That lump here is right above where the bracket attaches. So it's like a trampoline effect. This pushes in and it pops out.
Yeah.
The joints right above is like a trampoline type of effect. I don't have any answers for you. I'm just telling you.
What am I supposed to do?
So, well, I'll show you in a minute. We're going to try to put a Deneroll, and we're going to teach you right to start compressing this down. Understand what it does. That's what I need. We need to be understanding of that. This is a culprit that women have to deal with. This restriction. This is going to protect this area. It's not going to move. There is going to be a mechanical effect. Why do weightlifters and UPS drivers wear lower back braces? Because their lower backs are being injured and overstressed, and they're trying to limit the mobility. Pretty quick it comes up. This is cellular exhaust. Because it has no useful benefit in our body, I term it a toxin. You know, it's a waste product. You know, what do you call stool in your body? It's a toxin. It's waste. People get really bothered by that term. It's not a toxin. It is. It's waste. It's something that your body needs to expel. Oxygen binds to it to form carbon dioxide and water, and it's removed from your body. But it irritates nerves, you know, pain, inflammation. The shoulder strap. Getting this bruising out of here will make it feel better. Changing the posture will prevent it from rebuilding back up. And
So is it showing up everywhere or like in just areas?
Quite a bit.
Oh, okay.
I can see it from here.
Quite a bit. So it comes out in places. So the areas where there's the most muscular stress, you're going to see the most acidity buildup, right? So the areas that are doing more work, there's more lactic acid. Like I said before, it's all under the predication of posture. Our posture creates it.
That's crazy.
Yeah, that's what we're dealing with. All
Oh
that
my gosh.
inflammation in the shoulders. We want to get all that out of there, so that at least the tissue doesn't hurt so much, and then you're not feeling that's what they're trying to do the electrical stuff on, and
Yep.
drive it out of there. But I know, pretty rough.
It looks rough.
Breathe as best you can. Here we go. Good. There we go. Good. 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 You all right? You all right?
Uh-huh.
Breathe. Oh, baby. Oh. There we go. There we go. Good. All right. All right. But the butt, not the butt. Help. I know, so this is the sacroiliac joint, this joint here never really has surgery. You want to keep this joint as loose as possible. This is what we were checking when you're on your side.
Okay.
We want this, again, the joint below the lower back, joints above the lower back are responsible for why the lower back, and then obviously going down into the thigh. So getting this area moving as much as possible, piriformis area. This is what gets all spasmed. Sitting tightens up this area.
I hate that area.
Not that butt.
Yeah, like it doesn't.
I'm not going to go much harder than this, so.
You're doing great.
That I feel more.
Found a spot.
Ooh, I found the calf. Okay. You had any injuries to this foot? Any injuries to these toes?
I feel like the one time I did,
Uh-huh.
probably like 6 years now.
Uh-huh. Like this one doesn't feel, this right here doesn't feel normal. Right there has been busted, that toe. Let me see if I, yeah. Can you feel the difference? This is more normal.
Yeah.
You've busted
Like
or
flexible.
jammed it hard.
What did I do?
Feel this big nodule right here. This nodule doesn't exist on your right foot. Right here, it doesn't want to bend.
What did I do?
Yeah, it's been busted. So bones grow in the same way muscles grow, right? If you overwork a muscle, it grows, right? If you injure a joint, the joint says, I guess you're going to keep injuring me, so I'll get bigger as a result. Some of it can be postural. You know, our weight should be on our heels. And if the weight's on our toes, the toes are under extra stress and they grow. Yeah, these are just all tighter than they're supposed to be. Good. That, similar to the discs in your back, you want to rehydrate them. So unless we're really bending the knee, it's not getting much blood flow. Ultimately, we're going to show you, you want to stretch to the point where you can really open up that knee through bending it. But I'm just opening up that meniscus in here. It doesn't really heal. It can rehydrate. But when we're dealing with lower back, sometimes the knee, hip, knee, and ankle will fall apart, but it's really under the predication of the lower back. So getting your back healthier, that's how we're going to do it. So the lower back one's under compression. You're hitting that nerve. So we got to decompress right now. It's happening at the end of the day because of stress. Yeah, the disc is dehydrating. An interesting question would be to see how much height difference you have morning, evening. So a simple test is you can get up against a wall and right when you wake up, measure your height, and then end of the day do the exact same setup and see how tall you are. You might find you're losing a half inch, possibly, you really shouldn't see a huge difference, but when the discs are, dehydrating because of sitting, you're going to see a huge height difference. And that's why you're going to have more symptoms, because those discs are getting dehydrated from compression. And then that's why the ability to irritate that nerve is higher. All right, good job. Just going to tilt your head to the left for me. Tilt your head left.
Oh,
That was a good one.
that was crunchy. Okay.
I don't think so. I'm staying over here. I got you. Let me check this out top.
Sorry, I'll sit still.
Tilt your head left. Oh, that's good. Good
Giving
sport.
me flashbacks when I was a kid. No, I'm just kidding.
Danny, tell your mom come here.
Get over here! Oh no. I think my mom was really good at this one. Oh no, tilt your head. Yep. There we go.
That was. It's just crunchy.
Does it feel warm?
Yeah.
Mine always feel really warm after we do it.
Check the top part here. Go ahead and tilt your head to the right a little bit for me. I think the top.
like that one.
At the end of your day, you're doing stretching in the corrective sense so that you go to bed in the right position.
Okay.
Kind of like brushing your teeth before you go to bed. You don't want to not brush your teeth and eat a bowl of ice cream. You want to end the day with cleaning. So we want to end the day especially with putting your spine back in the right alignment. There's supposed to be a curve in your neck,
Okay.
and this is the retainer. They made a piece of foam that looks like my thumb, and it holds you. Idea is to hold your neck in this arch position. You're ready for this, so we take your hand and you sort of press into your forehead to get your head to sink into it,
Mm-hmm.
and legs are straight, and you just sort of relax and let the head sink in. It's going to feel a little odd because your neck is used to being forward and straight, and we're putting a curve into your neck, so it takes time to get normalized to it. Sometimes it's more difficult the second week you do it because you're starting to do it properly. Don't be disheartened when, it wasn't that hard the first week and then it became harder.
Yeah.
That's really, you're doing it probably better now. To get off, you don't just lift your head up off. What I do is I usually use one hand to gently lift my head, grab the device, and the back of your neck might feel warm and tingly. That's okay. That sometimes goes away the more you do it.
Mm-hmm.
Then roll your side and get up. Kind of middle upper neck is where we're trying to target.
Okay.
So I'm going to show you the wrong position, so I don't want it so high that it's just pushing your head forward. Does that make sense? I
Yeah.
want it to come down a little bit. And then I'll usually take one of my hands and then just sort of press into my forehead to get my head to,
Oh.
it makes sense, curve over the mold.
Okay.
Sometimes if your neck is really stiff, it's been a long day, your neck doesn't really want to conform to the mold, so you might need to press your head in a little bit and then see if it'll,
Hold it down.
just for a few seconds usually. I mean, I think it's better to have your arms down while you're stretching, but sometimes it just initially to help get the neck to conform, and then see if you can let your neck relax into it, and just let it be okay that your neck is curved. The first checkpoint really is 20 times doing it for 20 minutes. That's the first. So if you did twice a day, it'd be 10 days, right? If you did once a day, it'd take 20 days. You're trying to do it for 20 times, and that's when you're going to reach the sort of the first, whoa, Ed, I'm seeing a difference in my posture.
Yeah.
You have to stretch these rubber bands on the front 20 times so that they start remembering how to stay lengthened. It's either that or you got to start painting ceilings or stargazing more. We don't spend too much time looking up, and so because this is so foreign and this is so frequent, so it requires also trying to pull back from so much time looking down,
Yeah.
right? So we're not, when you're on your phone, try to bring it up. And then we'll talk about sitting in a minute. Trying to reduce the time you spend sitting. Evening time, don't, when you're watching TV, just lounge on your side, maybe lay on your
Yeah.
belly. I want to put this right below the bra strap, right about there. Lay back for me. There you go. Arms up for me. May I have your knees bent for this one? Yep, perfect, you got it. Yep, arms back, you're doing good. Yep, perfect, you got it. I don't need to overwhelm you, but I'm going to start taking these books out. Yeah, let's try taking one out. Let's try. Let's
It's
see how.
like on my shoulder.
Okay, all right, let's take
Oh.
it. I'll take it out. Yep, there you go. You okay?
Yeah.
Yeah, there we go. Good, yeah, you're doing good. I can tell you stretched. I didn't want to start at full throttle, so get you used to stretching a little bit. Rotate your knees left. Let them stretch. Yep, there you go. Good, okay. Then rotate your knees right. There you go. This is what you do at the end of the day. Like if your back is hurting
Yeah.
at the end of the day, you get on this device, put it in your middle back or even your rollers.
Can I put my legs down?
Sure, yeah, it's a deeper stretch. I just want you, every once in a while, I want you to do that knee side to side, because what'll happen is, to get off this, I can't have you do a sit-up. So you can put your legs straight, it's fine. But about every minute, I want you to bring your knees back up and then rotate. What can happen the first few times you do this, Ed, I'm stuck, I can't get off of it. So I want you to, I would love, by visit 10 or 15 times you've done this, you do the leg straight the whole time. But the first dozen times you do it, just every once in a while, bring those knees side to side. Otherwise, I want you to call me up, Ed, I need help getting off this, help! This is perfect, it's best, this is the curve that your back should have.
While sitting and laying.
All the time, yeah, all the time. Lumbar lordosis, 45 to 50 degree arch that goes completely straight when you sit, or if anything, might go the opposite way. So it becomes what we call kyphotic. And that kyphosis increases discal pressure, symptoms down the leg. Roll on your side, Now roll back on your back 1 second. Roll back on your back, breathe.
Oh, that feels so different.
Well, anytime you sit.
Oh, I can sit on-
Anytime,
okay.
yeah. I want you putting anything. I want something behind your back. trying to let your head relax your shoulders. Yeah, you can put it a little lower if you want, but my point is you want to have it.
Oh, that feels like where it was.
Yeah, you want to have pressure. You want to have pressure behind your back. The couch, do we have to sit in the couch?
No.
Okay, what I'm saying is
I
you
can
want
sit
to,
wherever.
I want to
You
reduce.
tell me and I will sit.
I would
Find
rather,
it.
well, it's like sitting is the new smoking. So it's like, well, I'm not sure if smoking's bad for me. Yes, it is bad for you. You understand?
It is
It's bad for
bad for you.
everybody. You shouldn't smoke. How about just a little smoking? No, it's still bad for you. A little bit of smoking is bad for you. A lot of smoking is bad for you. Sitting it's too much. Where I can, probably at our age, we can handle, I don't know, 6 hours a day of sitting. Anytime you're more than 6 hours a day,
Yeah.
you're creating a debt. So if you had to give me an average day for your work,
Yeah.
how many hours would you typically say you're sitting?
Probably like a good 6, 7.
Okay.
Yeah.
Then that's I would say that's not too bad. I have people come in here, they're 12, 14 hours of sitting, and so that is going to be hard to balance.
Yeah.
It's going to be hard to undo. So if you're down to 6, then let's start
Here. Okay.
putting the stretches in your back, and you should see some results. It's just a matter of, if you have a day where you're driving your car or doing a lot of sitting, and then you outside pulling weeds or working in the yard, whatever you're saying.
Yeah.
A lot of, even though you weren't sitting, this is the same.
Because you're still resting.
See what I'm saying?
Yeah.
So, well, I wasn't sitting, Ed. Yeah, but you're still. Anytime your thigh is closer to your chest, you're technically sitting. You're flattening this curve.
Okay.
So when your thigh comes up, this flattens,
Mhm.
and that's what then redirects all the stress to your lower back. So we need to have that sway in your back. This is my normal position. It's not like this is where I want to be, because these ligaments are stretched. So you'll actually start feeling it on the front side of your body as you do more of the stretching. And my ribs are getting sore.
Yeah.
Oh,
Aw,
thanks
thank
for saying.
you.
Oh, you did so well. Thanks so much. You
Just
really
watched
did.
all your videos.
Oh,
All right. Thank you.
wow.
Wow, really? Well, thank you for the support. That's really